Welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us this morning. Going to be in conversation with Dr. Zoe Memel. She's Department of Medicine at Mass General there in Boston, and she's going to be talking with us about some research presented at Digestive Disease Week, or DDW 2020, about aspirin use. Welcome to the program, Dr. Memel. Thank you for taking the time this morning.
Yeah, thank you for having me on the program today.
A bit about your role there at Mass General.
Yeah, so just briefly, my background is primarily in nutrition, actually. I received my undergraduate degree from Cornell. While I was there, I got my first taste at doing research with a 4-year weight gain prevention study and became really interested in the intersection of nutrition and prevention and health. I then went to the Keck School of Medicine of USC in Los Angeles, the medical school, where I spent my 4 years there primarily working to integrate more preventative medicine and nutrition into medical school's curriculum nationwide, and also really became very interested in hepatology during that time.
You participated in DDW 2020. You presented some information there concerning aspirin use and a particular type of cancer. Is that correct?
Yeah. So this past year, I started my medical residency at Massachusetts General Hospital. I'm currently a first-year internal medicine physician, and I knew that I wanted to focus in on prevention, and I found hepatocellular carcinoma, or liver cancer, to be particularly interesting, given that it's the third most common cause of cancer-related death nationwide. The abstract that I submitted and it was accepted to for DDW is called Aspirin Use is Associated with a Reduced Incidence of Hepatocellular Carcinoma, a Systematic Review and Meta-Analysis. And essentially, what I and my research mentor, Dr. Tracy Simon, did is there has been a lot of studies done over the past 20 years looking at aspirin use and hepatocellular carcinoma development and how aspirin may attenuate the risk of cancer development. However, every study that's been done in a different country uses a different study design and has a very unique patient population, making the results a little bit kind of hard to interpret. So what we did is we looked at all of the studies ever done and used statistical techniques to try to figure out a uniform way of figuring out if there really is an association with aspirin use and hepatocellular carcinoma.
And what were your findings? First of all, how did you pinpoint the types of candidates for the study?
Yeah, so that's a great question. So we used a medical librarian and something called the PRISMA guidelines, which are kind of a uniform, standardized way of reducing your bias when performing a meta-analysis. And we decided to look at studies that only looked strictly at populations that used aspirin and patients who did not have any evidence of hepatocellular carcinoma before taking it. And we kind of, through all of these different inclusion criteria, went from 16,000 studies to 17 articles that met our criteria. And based on those 17 articles, we were able to combine the data of 2.7 million subjects. 35% or approximately 1 million of which had used aspirin, 19,000 of which had developed hepatocellular carcinoma over a span of over 30 years.
How is this aspirin, how does it work to reduce this incidence?
Yeah, so we think that there's numerous ways that aspirin probably reduces the incidence of hepatocellular carcinoma. There's an enzyme called COX-2, and it is a very pro-inflammatory enzyme, and we think that by blocking it, it reduces systemic inflammation. It also prevents something called angiogenesis, reducing the vascularization of tumors, and most likely decreases tumor cell proliferation as well as fibrosis in liver cells. Based on our analysis, we found that there was a 32% lower risk of developing hepatocellular carcinoma in patients who took daily aspirin compared to patients who did not.
Were there any indications of any type of liver damage at all prior to the study? Were all of these people had absolutely healthy livers, or were some in certain stages of cirrhosis or any other liver conditions?
Yeah, that's a very important and great question, actually. So that was one of our concerns. Is some of the studies made sure to look at all the patients in their population and make sure that they didn't already have what we call fatty liver or cirrhosis. But some studies failed to look at this and didn't account for it. And we think that's why there were such varying effects of aspirin. You would think that if a patient had an unhealthy liver, the aspirin's effect wouldn't have been as strong. So we tried to account for that, looking at which studies took this into account, and we found that studies that did take this into account found a stronger effect of aspirin.
What type of aspirin use are we talking about? Twice a day, half a tablet?
So we tried to create a very accurate dose and duration response analysis, but the problem is there's something called a defined daily dose, which is something that the WHO organization created many years ago, and it's a standardized dose that can be used to kind of go across different studies, but only 4 of our studies used the defined daily dose. The other studies either didn't specify the specific dose or didn't do it in a standardized way. Based on those 4 studies, we found that just a daily 81 aspirin would reduce your risk of cancer by 8.4% per year.
In your field of study, what research trends do you see in general, and briefly, what do you see based on this study alone?
Yeah, so this was an observational study. So because of that, there are a lot of biases that still need to be figured out. I think that based on this study, there really is a good argument that we need to perform a well-designed randomized control trial where we give patients exact doses and monitor them for the safety effects. Making sure to also figure out what is the maximum benefit of preventing cancer while reducing the risk of bleeding, which is, of course, the biggest concern with aspirin. Yeah. Moving forward, there's also a huge interest in also looking at diabetes medications, such as metformin, SGLT2 inhibitors, and GLP-1 inhibitors, and how that may impact hepatocellular carcinoma. So overall, I think there's going to be a huge push at looking at other chemopreventative agents that can help prevent hepatocellular carcinoma.
Is there a website where our listeners can go and get some more information about DDW 2020 and look at some more information about aspirin use as it pertains to hepatocellular carcinoma?
Yeah, so our abstract is going to be posted on the DDW website, and we're actually hoping to submit this manuscript with a much more in-depth explanation of our findings in the next 2 weeks.
All right. Well, I thank you, Dr. Memel, for coming on this morning. It's been a pleasure just talking with you and lots of great information.
Yeah, thank you so much. I hope you have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this podcast are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.